We're seeing in the research that Tylenol possibly can affect the endocrine system, specifically testosterone, which then will affect the sex of the baby and also the organs that are made. Those are some of the mode of actions that how Tylenol can affect the neurodevelopment in a baby. Welcome back to The Root Cause with Dr. Jake. I'm a naturopathic medical doctor and an integrative physician. On this channel, I have real conversations with real patients to show you how to heal your body down to the root causes without any harmful drugs or surgeries. I'm here today with my co-host and patient to talk about, is Tylenol safe during pregnancy? It has been a go-to forever, but there's new research that has come out, including with our government and with RFK Jr., it's starting to make things go a little bit crazy. So we're going to talk about what is the research saying regarding Tylenol? Is it safe? Is there certain times you could take it? Are there all natural alternatives, etc.?
Thank you so much, Dr. Jake, for touching on this topic. I think a lot of people are wanting to know what is the actual science, because social media can say what social media is going to say, but it's all sound bites. It's all, who knows what the sources are that people are using when they're talking about it. And so being able to talk with a doctor like yourself, who has access to the research and be able to really share with us what it's saying and what your naturopathic integrative doctor perspective has on it, I think is really important. And then, of course, it's important because I know I took Tylenol when I was pregnant with all four of my kids. I think one or two probably more than others. But Tylenol does seem to be something that's pretty commonly used, right, Dr. J?
Yeah, so Tylenol is a very common use today. I mean, it's like 65% of women use Tylenol when they're pregnant. So they use it for back pain or fever or headaches. It's used for multiple different complaints that women can experience during pregnancy. So it's a very common drug.
Yes, and I know that it's been, historically labeled as safe in all of the trimesters, but all of a sudden now we're hearing that maybe it's not. And, what is that research actually showing? What does the science actually say when it comes to risks to the baby?
Yeah, so we're seeing that there could be some possible neurodevelopmental delays that can happen when you do take Tylenol. So what we're seeing in the research, there's a study that was done and looked at neurodevelopment and see if Tylenol use actually increased risk. So risk and causation is different, but they did see that there was increased risk of ADHD, autism spectrum traits, which is different than the firm diagnosis of autism, but there's certain traits that go along with autism. Also saw that there was a decreased IQ and some other behavioral issues that can go along with taking Tylenol during pregnancy. So they did see some increased risks with taking Tylenol and some of these neurodevelopmental disorders that I just stated.
Okay, so I think that's really important in clarifying is that the studies have shown, yes, there is an increased risk, but an increased risk does not mean a direct causation. It doesn't mean if you take Tylenol, your kid is going to be born with ADHD or going to have a lower IQ. There's just a higher chance that that could happen. And so it's very correlative, but that's worth knowing. It's worth knowing that this is a risk that you take. And is that something that you want to possibly risk while pregnant? We're going to put the link down below on one of the studies that was, a notable study by JAMA Pediatrics done in 2014, which showed a 20 to 30% increased ADHD risk. And then there was another one, Alkavist in 2024, and that's the one that found the autism traits, but they did rule out causation. Dr. Jake, can you explain a little bit more about how the studies were able to show that there's not direct causation?
So yeah, the study that was done in 2024, they looked at autism and they did see that there was a small correlation with taking Tylenol in children that with mothers that took Tylenol in kids that had autism. But they also did a comparison study and they looked at, okay, these were siblings of the parents that had took Tylenol and their kids had autism. Then they did a comparison with the siblings and the parent didn't take Tylenol and they didn't see that the kids, there was any difference between the two. So they couldn't make a confirmed causation there, but there is definitely some correlation possibility with taking Tylenol and being pregnant with possibly a kid being autistic. Obviously, there's a lot of confounding variables, and it's not like just Tylenol is the main thing, but it looks like we should be cognizant of it and maybe be a little aware that Tylenol has that possibility.
Yeah. So, okay. So to clarify this, it seems like, okay, they did notice that women who did take Tylenol, there did seem to be a higher amount of, in those women, right? A higher amount of births with children who had autism. So there was an increased risk that they saw. Not everybody had it, but some of them did. And then they were able to rule out the causation by then, out of this huge group that they studied, they were able to find some of these women who had, who took Tylenol with one child, didn't take a Tylenol with another pregnancy for a sibling, right? And were able to compare, okay, with the ones when they didn't take the Tylenol, did those kids have a, less of the, amount of the diagnosis? And we found that there was no difference. So it's interesting. It's like, okay, there's a correlation. We're seeing something, but it's not a direct causation. Maybe there's other factors involved that have to do with it that would imply it, but it's enough, I think, for some people to go, okay, do you want to take that risk? So for the possibilities, right? Like they've looked at the higher risk. Now actually going into, okay, why? Why could that possibly be happening? Why with some women and they're taking Tylenol and they seem to have, kids that turn out to have more of these issues. What's going on physiologically, biologically in the body during pregnancy if Tylenol is taken that could, and I want to clarify, that could, right? This is higher risk, it's not causation, that could affect fetal development.
Yeah, so what the mode of action of Tylenol is that it can decrease glutathione production in the liver. It's well known to do that. It's well known that it could cause liver damage because it does do that. So when we do decrease glutathione, glutathione is the main enzyme that we have in our body to help with detoxification. It also helps decrease oxidative stress. So it's a very strong antioxidant and also is an immune modulator. So if we decrease the body's ability in the liver, the mom's ability, and also the baby's ability to detox all the toxins that are coming into our life from food, environment, air, water, whatever, right? And then we decrease that, taking Tylenol, especially if you take it often and throughout all trimesters, could possibly deplete the mom glutathione and the baby glutathione, and then toxic overburden happens, and then that could cause inflammation of the brain and possibly lead to neurodevelopmental disorders like autism, ADHD, IQ disturbances, etc. But yeah, so it's the decrease of glutathione, and that leads to immune disturbances, inflammation in the brain, decreased antioxidants, which then that leads to increased damage and trauma to the brain or many other organs throughout the body. And then also we're seeing in the research that Tylenol possibly can affect the endocrine system, specifically testosterone, which then will affect the sex of the baby and also the organs that are made. Those are some of the mode of actions that how Tylenol can affect the neurodevelopment in a baby.
Now, this is interesting to me because what I see is that, okay, we can rule out direct causation, but I could see how it could be part of a perfect storm that for some babies is all that's needed. So correct me if I'm wrong, Dr. Jake, if you're talking about it depleting glutathione, which is essential for both moms and babies to detoxify, and you have a baby that has a genetic DNA sequence that mom and dad passed down to them that maybe makes it harder for them to detoxify in the first place. Maybe they have a MUF mutation or something like that, something else that runs in the family that just makes it harder for them. And then on top of that predisposition, you add in something that actually depletes their glutathione and maybe makes it worse than what it would have been had they not, that could set the stage for why some kids seem to come out with these traits and others don't. Does that, am I on the right track there?
Yeah, that's definitely true. I mean, yeah, if you're more predisposed to have poor detoxification throughout your body, and then you decrease another way to detoxify, yeah, that's probably a big reason why not everyone has issues with certain drugs or whatever that we take, but you could be predisposed based on your genetics, like the
Right.
MTHFR gene mutation or other mutations that you might have that will decrease your detoxification pathways or immune regulation, et cetera, can possibly lead to your increased risk of getting these conditions.
I'm even thinking about moms, we different things happen with different pregnancies, right? In one pregnancy, I might be living in an apartment in downtown where it's really smoggy and I'm breathing in a lot of dirty air. And maybe there was a fire that winter while I was pregnant and I was breathing in that. And maybe there was
Mhm.
another pregnancy where I moved and I lived in a different area and we didn't have any carpets there, unlike the house before. And so there was no, and these different circumstances where maybe with one pregnancy, I was actually exposed to more toxins than another pregnancy. I took Tylenol on both, but my body, because the glutathione was depleted, in the pregnancy where I was exposed to more toxins, my body and my baby's body suffered more from that lack of glutathione because of the toxins exposure versus my other pregnancy where maybe I wasn't as exposed to as many toxins. And so it didn't have a negative impact that affected behavior or other types of things that we see. Am I on the right track with that one?
That's perfect. Yep.
Okay.
Makes sense. Yep.
So again, I think that this goes back to higher risk. Sure, there's lots of other factors that can happen, but some of these are things that we just cannot control necessarily. And so just know that you are putting yourself at that risk in that situation. Now, Dr. Jake, I already brought up a couple of situations that I could see could be a part of a perfect storm. Overall, though, can you let our audience know who might be most vulnerable to the negative impact of taking Tylenol during pregnancy so that those people might be able to, maybe be extra cautious in their approach?
Yeah, so those that are most vulnerable, we talked about one, the MTHFR gene mutation that affects how your body methylates. There's other gene mutations that affect methylation. So if you are someone that doesn't methylate very well, probably not a good idea to take Tylenol. If you do have autoimmune diseases or other inflammatory disorders, probably would be you're more at risk to possibly have issues of glutathione depletion. You don't want to decrease your glutathione anymore. If you have anyone in your family or cousins or close relatives. Obviously, if you have any children that have autism, ADHD, or other behavioral disorders, I think it's a good idea to limit glutathione because likely you're genetically predisposed to probably be low in glutathione because people with these behavioral disorders are already low, like autism spectrum disorder, ADHD. What we see in the research is they tend to be lower in glutathione. So we don't want to decrease it anymore and increase that risk of some brain damage that happens from the decreased glutathione production that is caused by Tylenol.
Yes. And so I want to make sure and clarify because I think earlier you had mentioned decreasing the glutathione necessarily. It's like, no, decreasing the Tylenol usage because it decreases glutathione. And in this situation with a family history, we see that that's something that we don't want to have if you have a family history with these conditions. Now, what are your recommendations then, or what is the official recommendations then? In light of this new information of higher risk, what are doctors and researchers suggesting that pregnant women do differently moving forward in light of this new research?
Yeah, so what we're seeing is it was generally accepted safe in all trimesters, but what we're seeing in the newer data is we should probably limit it the best we can. If we could use some other means, best, or just use it if absolutely needed. If you have a really high fever, okay, you could use Tylenol, but don't use high doses and don't do long duration. You don't want to take Tylenol in every trimester too. You want to try to limit that. So you only use it if absolutely needed and then use other alternatives instead because you don't want to take something that depletes of glutathione if you don't need to. But if you take it like once or twice, probably okay. But it's a problem when you continually take it, like it's habitual. You don't want to be doing that. You don't want to take it as a preventative or habitual intake for your back pain, for example. You want to only take it for in certain situations when you're pregnant.
Okay, so for pregnant women who maybe do struggle a lot during pregnancy with headaches or back aches, and their prior go-to has been just popping that Tylenol, a few times a week, what would you suggest they do instead in order to minimize the potential for negative effects?
Yeah, there's definitely some things that are more natural, much more safe than Tylenol to start with. So we could start with magnesium. That tends to work really well on decreasing headaches in women and men when they have headaches, and it can work really well for women when they're pregnant. Also, B6 depletion can be a cause of headaches in women, also be a cause of nausea. So taking extra B6 supplementally can be really beneficial. Chiropractic or craniosacral, sometimes the headaches are caused by the ligament laxity and weakness of the tissue there, and the bones could kind of go out of place. So getting some adjustments can really help with the neck pain that leads to the headaches or the back pain caused by the back being out of alignment. So those are some natural things you could take for that. So for like, if you do have like a fever and you want to look for an alternative there, you could do like elderberry tea. That's very safe and gentle. You could do a yarrow tea. Something that you could really do is a tepid bath, like a cold bath that you could take to really decrease your fever as needed. And that works really well and much safer than something that can deplete yourself of glutathione.
And then, Dr. Jake, what about inflammation specifically? Because I know, especially women with autoimmune conditions, right, and they're pregnant, they're still dealing with inflammation. What can we do about that?
Something that we could do about inflammation that women might be dealing with during their pregnancy is you could take ginger. I wouldn't take supplemental ginger. You don't want to do high doses. You need to be safe with that. High doses could be a problem, even though you could take about quite a bit, but probably best to do it in food. So eating food that is higher in turmeric, higher in ginger, those can really help decrease inflammation throughout the body. Obviously, the tepid bath can also help with the inflammatory processes also. Another thing that you could do for decreasing a fever is you could do another type of hydrotherapy is you could do a cold sock therapy that you put on your feet before you go to bed, and that can really help with the fever too.
Excellent. Dr. Jake, you've been so helpful. This has been very helpful information, I think, for any women out there who are just wanting to know really what is the science actually saying and what should they do. So I really appreciate you giving these details. For those of you who do, maybe are pregnant and wanting to get some help with autoimmune issues during your pregnancy, or you want to get, look at your detoxification and what's going on with that. You just want maybe you're even preparing to get pregnant. And you want to make sure that your body is ready for a good, healthy pregnancy. And you want to get a good checkup in all of those areas. You can get a hold of Dr. Jake by calling 801-938-7965. We also have a link that we're going to put down in the description box below for those of you who are watching on YouTube, where you can schedule a 15-minute call with him or his team to be able to talk about what it is that you're wanting to do and see if they've got a plan that could help you. And you can do that at drjakewellness.com/schedule. Dr. Jake?
Yes, if you want to learn more about the appropriate use of Tylenol or other alternative therapeutics, click my videos to the right. I'm Dr. Jake, and I'll see you there.